Welcome back. Now, every 9 minutes in Australia, someone suffers a stroke. But Australians are being denied the latest advancements in stroke treatment. And for some, it means the difference between life and death.
I was told by the doctors because they could not perform the surgery and there were absolutely no other options that we just have to sit there and pretty much wait for him to die.
When George Teosanis' father, Nick, suffered a massive stroke in August last year, his family were offered a glimmer of hope.
The doctors told us there was possibility of recovery with a new procedure called endovascular clot retrieval.
Nick would be transferred from Wollongong Hospital to Sydney for the surgery, but the ambulance was delayed. And by the time it arrived at Prince of Wales Hospital, the medical support team had finished their shift and the surgery couldn't go ahead after hours.
I mean, the surgeons were there. They were keen to do the surgery, and the only reason they couldn't, because their support team went home. It's just really, really hard to comprehend that something like that could happen.
The blood clot continued to block oxygen supply to Nick's brain, and 4 days later, he died.
I think if the clot retrieval went ahead, that the outcome could have been very different. You know, my dad had a chance, a fighting chance of recovery.
Endovascular clot retrieval is a breakthrough procedure offered to eligible stroke patients where the blood clot is pulled out of the brain through a removal stent and has been shown to nearly double recovery and survival outcomes.
Clot retrieval therapy, I think, is possibly the biggest thing in medicine in the last 50 years and possibly even since the development of antibiotics. Many of those patients who would certainly have been disabled or dead have not only walked out of the hospital but have returned to functioning members of the community and full-time work.
But the procedure requires specialist surgeons and equipment, so access is restricted to selected hospitals across the country. Following the death of Nick Teosanis, New South Wales moved to provide 24-hour clot retrieval in 2 selected hospitals. Some other states and territories offer it at limited times or not at all.
I think if a patient misses out on this treatment, yes, that they are going to end up disabled or dead. It is time critical because when a vessel in the brain is blocked, you lose up to 2 million brain cells every minute.
The earlier treatment is given, the better the outcome for the patient.
So we need hospitals to be resourced so that they can respond 24/7. A stroke can happen at any time to anyone, so we need a system that is responsive 24/7.
Stroke Foundation CEO Sharon McGowan says access to clot retrieval therapy is just the tip of the iceberg when it comes to Australia's stroke care problem.
Australia is lagging behind the rest of the developed world in our response times to stroke and getting access to quality stroke treatment across the country. If you live in a regional area, you're 19% more likely to have a stroke, and yet you have the poorest access to specialist stroke services.
The day Stephen Ward had his stroke, he was at his Hunter Valley home looking after his young son, Patrick.
When I came home, Patrick was calling out, "Daddy, Daddy," and I walked into the house and I found him on the office floor. He was awake, his eyes were open, he couldn't say anything to me and he just looked really, really scared.
Tracy immediately called 000 and told them she suspected stroke, but the ambulance took Stephen to their local hospital at Muswellbrook, which doesn't have a stroke unit.
I could see that Stephen was deteriorating in front of my eyes, and I remember saying to the doctor, "What about that stuff you can give people who have strokes to reverse it?" And he looked at me really sadly and he said, "Tracy, we can't give him this stuff here, and we don't have this equipment here in Muswellbrook."
Stephen was airlifted to John Hunter Hospital, but the helicopter was delayed and he missed the 4-hour window to receive the clot-busting drug TPA. As a result, Stephen spent 6 months in rehab and his small steps towards recovery have been excruciatingly slow.
The dog and cat eat milk.
With only 7% of patients accessing clot-busting treatments, we know that we can save lives and reduce disability by increasing those treatment rates.
The Stroke Foundation is calling for a national action plan to help close the gaps in stroke care across the country.
This doesn't have to be one of the biggest killers in Australia. It doesn't have to be one of the leading causes of disability, and it shouldn't matter where you live. You should have the right to have access to quality stroke care.
Just because we live 150 kilometres from our nearest stroke unit doesn't mean we deserve to be treated like this. If he'd got treated quicker, he'd be back at work today. Now, he's got much less of a chance of doing anything like that ever again.